Restless leg syndrome is characterized by an unpleasant, creepy, crawly feeling, usually in the legs. Relief is only perceived with movement, and even then, only temporarily. It tends to interfere with sufferers' ability to get to sleep at night. It can begin at any age, but is most prominent in the middle-aged and the elderly. There is a genetic component, and it is sometimes linked to iron deficiency or to dialysis treatments. Caffeine, stress, and uncomfortable room temperature, either too warm or too cold, can intensify symptoms along with alcohol for some people. Strangely, restless leg syndrome tends to disappear with a fever. Sufferers may or may not experience daytime tiredness. Treatments consist of good sleep habits, avoiding the before-mentioned irritants, and can be relieved in some by stretching, massage, heating or cooling treatments, moderate exercise, and/or relaxation procedures. If none of these are successful, one of several types of medications can be prescribed. People with periodic limb movement disorder experience periodic muscle contractions while sleeping, causing jerks in their legs or arms. These periods are markedly similar in individuals, ranging from 0.5 to 10 seconds, and intervals from 5 to 90 seconds apart. They are more likely to occur in the first half of the night, causing multiple awakenings during that time period. There is usually no awareness of the jerks and only awareness of a few of the multiple awakenings. Sufferers of the disorder, not surprisingly, experience excessive daytime sleepiness. Therapy is identical to that of restless leg syndrome just discussed. There are many forms of circadian rhythm sleep disorders, but the two most prominent are the phase delay type and, to a much lesser degree, the phase advance type. People with phase delay type are extreme evening types, also known as night people or owls, right? But really extreme. Extreme meaning that they choose to go to bed very late, like 3 a.m., and get up very late, like 11 a.m. Those with phase advance type are extreme morning types, otherwise known as larks, going to bed at 6 to 9 p.m. and getting up at 2 to 5 a.m. Delayed rhythm type is easy to confuse with insomnia because sufferers have difficulty getting to sleep. However, upon further investigation, it is discovered that they have stable 24-hour cycles and no difficulty going to sleep unless circumstances require them to go to bed and get up earlier. And of course, the reverse is true with phase advanced type. Treatment of circadian rhythm sleep disorders is challenging because no amount of willpower or sleeping pills will help. Treatment involves a more extreme form of the same treatments that are used for jet lag. Here's another interesting one: sleep-related eating disorder. Compulsive eating or drinking while asleep occurs in some people without their fully realizing it until the next morning when they discover empty containers, items missing in the refrigerator, and other remains of their nocturnal meal. They often specifically consume large quantities of highly caloric foods, and thus this can cause significant weight gain. Sometimes they even ingest inedible substances, such as buttered cigarettes. Yes, you heard me correctly, such as buttered cigarettes, causing digestive difficulties. These episodes can also result in poor sleep quality. Although sleep-related eating disorder is not associated with actual hunger or any of the waking eating disorders, it has been found to be associated with restless leg syndrome, obstructive sleep apnea, and the use of the sleeping medication called Ambien, especially in females. Treatments consist of stress reduction, hypnosis, and identifying and avoiding other individual precipitating factors.